If you are watching this video, you or a loved one is probably suffering from pain, an injury, or weakness, and you are wanting to get some help from a medical professional. And since you have a PPO insurance plan, there's some important information that you should know before you begin. In this video, you will learn how to navigate through the process of getting care while applying your PPO benefits, so that you can make informed decisions and focus on getting better, not insurance headaches. If you have a PPO plan, it's important that you understand that you have freedom of choice. You can choose the provider you wish to go to, whether they are in-network or out-of-network, and most likely you will have benefits that can be applied towards your care. Here are some things most consumers don't know. Number one, most PPO plans have a deductible whether you choose an in-network provider or out-of-network provider. What is a deductible? In simple terms, it's an amount that must be paid by you before your health plan activates and turns on. Typically, this amount ranges anywhere from as low as $200 to as high as $10,000, depending on your plan. Some plans may fall out of these ranges. It's important to note that your deductible may be different for in-network versus out-of-network providers. What is an out-of-network provider? This is a provider, typically a medical professional, who has chosen not to participate with a particular health plan. They would be considered an out-of-network provider. With a PPO plan, you have the freedom to choose out-of-network providers, and sometimes they may be the better choice depending on the nature of your condition. Why does a provider choose not to participate? There are many reasons why a provider might choose not to participate with the health plan, but one of the common reasons are due to the decreased reimbursement rate the insurance imposes on that provider in order for that provider to join the network. Oftentimes, the rate is too low for the standard of care the provider wishes to provide. Typically, the level of quality provided by an out-of-network provider is higher than an in-network provider. This is largely due to the out-of-network provider's avoidance of time-consuming insurance hassles and steep discounts. If you choose to go to an out-of-network provider, make sure you understand these important steps. Find out what your deductible and/or copay might be. It's best to be informed prior to making any final decisions. It's best that you call your health plan yourself. It helps to avoid any confusion and that you can get the most accurate information in order to avoid any future unexpected bills. One word of warning: when calling your insurance company, it is customary for the insurance representative on the phone to attempt to dissuade you from going to an out-of-network provider. This is because the insurance company saves money when you choose someone who is in-network accepting discounts for their services. Lower rates don't always equate to less quality care, but oftentimes they can. If your condition warrants a higher and more specialized provider, an out-of-network provider may be the preferred option of choice. In many cases, with physical or occupational therapy, for example, conditions often resolve before the deductible amount is ever even reached. So choosing an out-of-network provider versus an in-network provider bears little or no consequence. With a PPO plan, you are paying for the freedom of choice. So if there is a provider you like and you prefer to go to, and you wish the very best possible care for your particular condition, you can choose them. Remember, it's your body, it's your health, it's your choice.